Welcome to Safety Talk. Personal safety expert Pete Canavan shares his insights and interviews experts who provide simple and effective tips, techniques, and technologies to keep you safe and secure both online and off. Here's Pete.
Hello and welcome to Safety Talk. On this show, we discuss and bring attention to a wide range of personal safety and security products and solutions that are available to businesses and individuals in both the digital world and the physical world. I'm your host and personal safety expert, Pete Canavan. As a self-employed information technology consultant since 1995 and as a martial artist for over 20 years, I bring decades of personal safety and security experience to my role as the host of this show. To learn more about how I can help your corporation, college, or conference, please visit my personal website at petecanavan.com. So thanks so much to our listeners for being here today. We've got another incredible guest, and it is what is sure to be a very informative episode for you today. Our guest has been a pediatric cardiologist and pathologist for nearly 40 years and has been a recognized authority on healthcare policy for more than 20 of them. His education and training has included Yale, Chicago Med, the Mayo Clinic, Northwestern University, Harvard, and he also holds an MBA from Anderson Graduate School. He has published more than 250 articles and 12 books on the practice of medicine, as well as healthcare policy in the United States. His latest book, Curing the Cancer in U.S. Healthcare, States Care and Market-Based Medicine, offers both the correct diagnosis and the curative treatment for a critically ill patient we call the U.S. healthcare system. Today, as part of our discussion, he will put the COVID-19 virus in proper perspective for us, and more important, he will explain what we must learn if we want the next outbreak to be less of a problem. So I want to first and foremost thank him for his selfless service as a healthcare practitioner and for working to heal countless children, I'm sure, as I'm pleased to welcome Dr. Deane Waldman to Safety Talk. Welcome, Dr. Waldman.
Happy to be here.
It's great to have you on the show with us today. There's so much I want to discuss with you, so we're going to see how much we can squeeze into our hour here today together. Sound good with you?
Sounds like a plan.
Okay, fantastic. So we'll start right off, obviously, with what is current at the time of this recording is the COVID-19, the coronavirus pandemic that is sweeping the globe. And with every passing day, we are learning more and more about it. And a lot of it is not good. And so as a medical doctor with over 40 years of experience, obviously my first question to you, sir, is just how serious is this in your opinion?
I think it is less serious than people think it is. That doesn't mean it isn't serious. It just means we are dealing with, frankly, the major reason for all the fear is unknown rather than this is a biologic agent and it's suddenly, oh my God. I mean, people are talking about comparing this to Ebola, which I think we really need to begin to develop a sense of perspective. And I want to say up front that what I'm now going to say, I couldn't say 2 months ago. 2 months ago, we didn't know much at all about this virus, about its behavior, about its case fatality rate, about how it was transmitted, all these things. So it was reasonable to be very fearful of, oh my God, is this, another, plague, or what is this? So that was a reasonable position for both the administration, or for that matter, for people to take, to be really scared. However, now we know some important things, and I think that we need to back off on the hysteria. For instance, if you're a healthy, 30, 40-year-old, the likelihood that this will harm you or kill you is extremely remote. It is the 80-year-old diabetic with chronic lung disease who's been smoking for 40 years, who also has some heart failure. That's the person at really significant risk. And even so, the risk for that person statistically is around 1 in 7. For the average person, it's 1 in thousands. So I am trying to suggest that people need to be less fearful. Now,
there are some numbers, though, that have come out that have broken down the fatality rate according to age range. And it's one of the things that I've used to communicate to my kids. I have 3 teenage boys about the seriousness of the problem, because according to the latest information that I saw within the last few days, about 18% of those that were dying were between the ages of about 18 and 25 or so. So that's high. That's almost 1 in 5.
The real issue here is pre-existing condition. And what I mean by that is for all you know or I know, God forbid what I'm saying is true of your boys. If you don't have a healthy, normal immune system, whatever your age is, you are at risk of serious illness or even death from pretty much any virus you want to name. This one's certainly included in that list. So therefore, I have to wonder about a lot of these healthy people who are 30, 40 years old who die with coronavirus. Is that because they really were healthy or not? I don't know. My point is that this is not Ebola. This is not, I mean, give you statistics. Ebola, the case fatality rate for Ebola is 88%. The case fatality rate for this virus across the board, regardless of age, is 2.7%. Now, okay, I would just assume 0%, as would you, as would everybody. But the fact is, it ain't Ebola. That's the point that I want to make, that this isn't a deadly virus except on infrequent occasions.
So I think part of what's going on, and I'm sure you'll agree, is that because of that unknown, and because it's sort of being, pushed down our throats every day by the media in terms of how many infections and how many death rates, and they're not focusing really much at all on the recovery numbers, which are significant as well. Obviously, we want them to be as high as possible, but it seems that the rate of infection and the ease in which this is spreading is what is such cause for alarm. And hopefully the vast majority of people that are healthy will be recovering from it. But when I see young people also succumbing to it, that is something that is concerning to me. I mean, I have work that I do as an IT consultant for various businesses, and some of those include hospitals. And I was at Williamsport Regional Medical Center a few weeks ago. And this was when things were just really starting to percolate and come to, ahead, and people were kind of thinking about what's going on. So I was like, you know what, I'm not going to be coming back here, for a while. And they actually called me about a week later and were like, hey, we need to do something else. I was like, I'm not going back here. I don't want to be in a hospital if I don't have to, Right. I have an N95 mask. I have PPE gear. I've got gloves and whatnot. But it's still a very scary emerging situation at this point in time, as I said, as we're recording this, and hopefully it does calm down as quickly as we can. But having to remain at home, self-quarantine for a month or more is, I think, going to cause way more problems. And I am totally sympathetic to the president, as well as everybody who's concerned about the economy, because the economic repercussions of this are going to be felt for years down the road.
Or frankly, I fear devastating. And let me put this a little bit in perspective, which is why I'm trying to calm people down. The death toll, as of, 3-4 hours ago when I last checked, in this country was 4,700 people. The flu last season killed 61,200 people. Right. 40,000 committed suicide last year, et cetera, et cetera. So my point is, look, I don't want anybody to die. Sure. I'm a physician. That's my sort of commitment to life. Having said that, 4,700 is not a reason to crush, and that's the only word I would use, the economy. And there's something else you brought up that I want to bring up right now, which is the number of people who recover. think about this. The way you really stop any epidemic, any viral epidemic, is by immunization, whether that immunization is by vaccines, as in, diphtheria and smallpox and so forth. We immunize people against that so that we have what is known as herd immunity. So right. Even if a smallpox virus got out into the community, most 99% of us have herd immunity because we were vaccinated. Now, we don't have a vaccine for COVID-19. Those recovered people and all the, I think, probably millions of people who have COVID virus, because this is a very contagious, easily spreadable disease, and we're not testing everybody. We're only testing those people who have the potential to be symptomatic or, God forbid, seriously ill. I'm hoping that we are developing herd immunity, and that's the way we're going to stop this virus, not by social distancing. Social distancing prevents or reduces the spread, but the people who get it, who are healthy, who then recover, who then have antibodies against it, are the herd that is immune, and that's what stops a viral epidemic.
So, Dr. Deane, I'm glad you said that about the flu and the numbers comparatively to this, because tens of thousands of people die every single year in this country, and we don't shut the economy down.
61,200.
Yeah, see, that's a ton of people, and we, of course, we don't want to see anybody die from it, but the bottom line is people do die from it. So, I've also read that this could end up being a seasonal thing like the flu, but I've also read that it has, I guess, I don't know if you would call it features, but signatures of HIV and MERS and SARS. So does that sound more like a bioengineered virus versus a naturally occurring one, or is it just sort of like something that is evolved?
I would argue that in some ways I might be a conspiracy theorist, but not in this. The fact is, I don't think this is engineered by anybody. I think nature created this just the way SARS was created, just the way, these viruses naturally mutate, and there are plenty of them sitting around in animals right now that we don't know about. But I'm sure you know this, but your audience needs to know. Right now, Pete and I are sitting here, and each of us has got as few as maybe 3 or 4 and as many as 10 or 12 viruses alive in our mouths right this minute. The fact is, if you don't have a virus that makes you sick, if you have a virus but you're not sick from it, you don't care. And my point is, there are, I suspect, millions of Americans who have COVID-19 who I think are going to develop immunity and are going to provide the herd immunity that's going to stop this more than anything else. By the way, I don't know if you know this, for sure Kaiser in California and I think somewhere in New York are testing vaccines right this minute.
Wow. No, I did not know that. I heard something that, they were hopeful that something was going to come to fruition soon.
They're already testing. I have no knowledge of the results of the test. The fact that nobody's yelling and screaming that it works makes me a little worried. But the test started, I'm guessing, 2 weeks ago, maybe 3 weeks, but something already. Like 2 weeks ago.
So that leads me to another question, which is, so you don't believe this was something that escaped from the lab in Wuhan about 20 miles away, that infectious disease research center?
I think it escaped from a bat in or some other live animal in the live animal
in that wet market
in somewhere in Wuhan, and that's what happened. That's
okay. And then the other thing is, do you believe it's been out there a long time? Because you said you believe millions of us probably have it and aren't exhibiting symptoms, just like the flu.
No, I can't say that. I can only say we know that it's been out in Wuhan since November of 2019. The reason I said millions is because before we really clamped down on the country, there were hundreds, possibly thousands, but let's say hundreds of people who brought in the virus, and it's so easily spreadable, contagious on hard surfaces, on stainless steel. It lives for up to 3 days. In New York, everybody is next to everybody else. I mean, I grew up in Manhattan. Yeah.
That's where I'm from. I was born in New York too, grew up in North Jersey. It's like very, very, compact. Everybody's right next to each other.
Yeah. So, and, it's a hub for travel. So I don't think it's unreasonable to think that there might be several million Americans. Frankly, I think there are several million Americans who, if we tested everybody, would test positive. And they're fine. They're healthy.
Mm-hmm. See, and unfortunately, I don't think enough people are saying that. Now, obviously, we don't know everything, but we have to look at it like, well, how have we dealt with viruses in the past? Yes, there have been some really bad ones. We had the Spanish flu 100 years ago. Obviously, that was horrible. And we've had things like Ebola and MERS and SARS and, HIV and swine flu, H1N1, right? We've had all of these things that have appeared, in the last 50 or 100 years. And this one, for whatever reason, has lots of people, I think, panicked is really the appropriate word, because of the way that the attention is being, given to it. You can't get away from it. Every email, every text, everything on television is about it. And yes, we need to stay informed, but we also need to do what we can to try to mitigate, being bombarded with so much information that kind of just gets everybody to, want to sit in their house forever and not come out and get into a state of depression. And the president is right in saying, we got to watch what happens. And that's why the guy needs to be a cheerleader for the American people. He needs to give hope out there. Now, he was very serious yesterday when he spoke, because it is serious. I mean, 100,000 people dying is not a good thing, right? I mean, with the economy has been going great.
I really have my doubts about that number, quite frankly. I mean, if you look at the rate of, quite frankly, case fatality rate for this condition over the last 9 weeks, the likelihood that we're going to get into the 100,000, I think, is extremely remote. I think it's more likely, and I repeat, I want 0, but I think it's more likely to be in the 15,000 range. And then we're going to turn around and go, well, wait a minute. Last year's flu killed 60,000, and this thing killed 15,000. Why did we go ballistic? And I think it comes back to what you said a minute ago, which is, for reasons that I don't think I want to get into, the media has taken what is a danger and turned it into a nightmare. And
yes.
I think that they've ginned up this thing where people are terrified of a virus that is very unlikely to do harm to you. You're a healthy young man. Me, I'm old, so maybe I'm at risk. Your boys, your wife, they are at low risk, very low risk, not high risk. And I think that somebody needs to be out there saying that. And I wish that Dr. Fauci wouldn't be talking about 240,000 people dying.
Right, because that's sending a message that, people are thinking, oh my God, it's almost 250,000 people. How many people are in this country? One in how many are probably going to die? Is it going to be me? Is it going to be my neighbor? Is it going to be my kid or my wife? And so now our brains start to do all of these crazy things, right? We start to think about this, and it can run rampant because we can't get away from it. So let's kind of shift gears a little bit and look at it at the China standpoint, because the president's called it, the Chinese virus, the Wuhan virus. And, so many viruses are named after the places they came from, right? I mean, that's just what you do.
SARS,
of course, the media wants to say it's all
virus.
Yeah, the media wants to call everybody racist all the time. But, was it appropriate for him to call it the Chinese virus?
Of course it was. And there's no reason to politicize any of this stuff. I really have a disdain, frankly, for our politicians, mostly in Washington, who are politicizing it either way. And I got to give a lot of credit. I don't know if you've been paying a lot of attention to this, but a lot of the governors are doing exactly what they should do, which is they're deciding what is the best approach for their state, for their people, and they have differences of opinion. If you look at what Florida is doing versus what New York is doing, I don't want to sit here and say which one's right, but I do want to sit here and say that those governors have the right to make the decision rather than be told what to do by Washington. And we'll turn out 3 months from now, we'll find out, was the soft lockdown in Florida better or worse than the total quarantine in Manhattan? I don't know the answer to that. I have a guess, but I don't like speculating, so I only make statements based on evidence. And the fact
and
is,
time will
evidence.
tell. Time will tell.
Time will tell. But I reiterate this number, this fear of death by COVID-19. Put it in perspective. 4,700 people have died in 9 weeks.
So why is it 19? Is this the 19th coronavirus we've identified?
Stands for coronavirus. So C for corona, V for virus, D for disease. And since many of the viruses, specifically SARS, MERS, the common cold, are all coronaviruses, they're qualifying coronavirus disease with the year in which it was started, which was 2019.
Oh,
so that's
okay.
why it is COVID, coronavirus disease, 2019.
So glad you clarified that, because I did not know that. I thought maybe it meant the 19th one. I didn't really do a bunch of research on it, but that's what they called it, So is China responsible for this? Should they have done more? Because every day we're finding out they look like they really dropped the ball, and they suppressed a lot of the early reports that their medical staff and their doctors were trying to say, hey, we need to keep an eye on this, and they were like, nope. And now we've heard doctors have disappeared. Some of the initial ones have died. What do you think in terms of their responsibility to all of this?
I regret that I'm going to say what I'm going to say, but I have to be truthful. They behaved the way a totalitarian system behaves. They want to control information, and that is more important, and control people, more important than pretty much anything else. Specifically, you said Dr. Lee, who is the first person to actually call the alarm, died of the coronavirus.
Right.
The lab, very interesting. Here's another piece of interesting information. The lab in Shanghai that identified the genome of the COVID-19 released it on the internet on January 11th, 2020. On January 12th, 2020, the Chinese government closed down the lab.
Unbelievable. It's so sad. It's so sad because what their actions have caused countless people to suffer and die, and all in the name of trying to basically save face. And
that's exactly right.
And it's a sad state of affairs when that's the sort of reaction that they do, because they want, like you said, that totalitarian control over the people, over the information, and the flow of that. And something I read, which was really interesting, and the only way it was found out was because of monthly reports that come out from the cell phone providers. And I don't know if you've heard this, but how they've said only so many people have died from this in China, 3,500 or whatever it is now, but that in the last month, 21 million cell phone accounts were closed. Now, why would that be the case? Is it just to shut it down so people can't talk? Because in China, your cell phone is everything. They track you on it. You use it to pay for everything. It's essential.
China threw out, what was it, about 10 days ago, there were, I think the number was 11, but there were a number of Wall Street Journal reporters who were trying to get at the root of the history and what was going on in China, and China expelled them.
Yes. Unbelievable. But
Now,
yeah, I mean, that's an interesting stat.
let's look at something good from that truth, that experience. We are learning a couple of things. We, the United States. Number one, we are learning that regrettably we cannot trust the information that came out of China. And sadly, since the World Health Organization seems to be in China's pocket,
Yes.
we no longer can trust the information coming out of the World Health Organization. I'm sorry, I wish it were otherwise, but we are once what is it? Once bitten, twice shame on you. Twice bitten, shame on me. Well, we've learned a lesson. Number two, more important, my friend Chip Roy, who is a congressman from Texas, is introducing, or at least supporting. I like the guy, so I mention his name. He's a really smart, good person. Introducing a bill to assure that our pharmaceuticals are produced in United States or United States territories. Apparently, by history, over 20 years ago, something like 40% of our pharmaceuticals, or the intermediaries for our pharmaceuticals, were produced in Puerto Rico. But the tax laws were changed, and that literally crushed the industry in Puerto Rico. And since it's cheaper, we can get it from China. So we are getting something like 90% of the precursors and the intermediaries of our drugs. I mean, I think about Cipro, and which is the specific for anthrax. God forbid there were a biologic attack, and I'm not. Let's just say it out there.
If
do we have enough manufacturing capability to create 330 million doses of Cipro right now? I would bet the answer is no.
There's no way.
Well,
the Chinese producing all of this. There's no way.
We need to be dependent on no one, and I say this with some disdain about China. Something like 30 or 40% of our intermediaries come from India, and I certainly trust the Indian government a hell of a lot more than I do the Chinese government. But I still say we have to be independent when it comes to these life-saving modalities, so that we can do what is in the best interest of our people, and that means controlling our pharmaceuticals.
And President Trump has been saying this for many years, since way before he was president, that there was a major trade imbalance, that we were too dependent on China, and of course, and borders, right? So how many nations figured out how important borders were during all of this, right? So this global economy concept, which has been pushed for decades, and now has gotten to the point where pretty much the only thing we produce in the United States is debt, right? Is the problem that we're seeing now, which is we're so dependent on China and other countries, but so much so on China because it was always, these companies look at it as dollar signs. Like, we can manufacture over there, we can save a ton of money, we can make a lot more money here, let's do it. And, one of the things that the president has done is he's been able to bring some of the manufacturing back, but I definitely agree with you that this is going to accelerate that process, and we're going to see a lot more of those critical pharmaceuticals and industries come back to the United States, like the ventilator production, right? We're not even making that many in this country. We do, but again, it's another product, right? And it's kind of been the joke. It's like everything you pick up, made in China, made in China, made in China. Well, it's because it's gotten to the point, and we've allowed them to do that, and we've exported our money to them in exchange for the products that they sell to us.
Let me amplify that in this way. I have an MBA, and so one of the things that they hammer in business school is for a business, or for that matter, an industry, or for that matter, a country, to be successful, you need sustainable competitive advantage. Right. Okay? What does the United States have as sustainable competitive advantage? One word: innovation. And if you look at all of the technology, including the ventilators, how they work, how they're efficient, how they remain free of germs, et cetera, all this technology really was innovated in this country. And what we need to do now I'm on the sort of geopolitical end, but more than health.
It's all relevant, though.
But it is all interrelated. We need to not suppress with government regulations and so forth. We need to encourage entrepreneurship. We need to encourage innovation. We need to encourage risk-taking. And by risk-taking, I mean financial risk-taking, which is what, I'm sorry to say, the left side of the political spectrum wants to say, oh, you should be secure, the government will take care of you. And I want to say, no, I want to do it on my own. I want my next door neighbor to invent something new and make money on it. And oh, by the way, it'll make my life better. That's our national sustainable competitive advantage, and we need to do more to release it.
Amen to that, because it's true. This country was built on it. That's what makes us such an incredible, beacon in the world, is the fact that we have the freedoms to explore our desires and our interests and the things that we're passionate about. And we don't have to be told all the time. But as you said, the left wants to make it so that you get a certain amount of money, and this is it. You get your health care and you get everything. I mean, thank God we didn't have socialist health care during all this. Oh my goodness. I can't even, makes me shudder to think about it. So,
well, I got to say, I love the fact that the president went out there and said, we need a public-private partnership. We don't need the government mandating ventilators. Well, that's like the government, Obamacare mandated health care. That is my services as a physician. You can't do that.
Nope.
Not if I'm a free person. So
that opened up Pandora's box.
I can't applaud him more than saying the right thing to do was to say, the government will help you, will get out of your way, business, go make 200 million masks or 500 million masks, go make 100,000 ventilators right now, please do it. Mm-hmm. Yeah, you'll make some money, but meanwhile, our people will get ventilators and masks and whatever.
Yep, and he was right to try to do it without invoking the Defense Production Act. Everybody was screaming at him, why didn't you do this? Why didn't you do this? Because if you ask them, you don't have to force them, and that's a much better relationship going forward. Because if you tell somebody to do something, they're going to resent you for that. I don't care who you are, what you do, what company, what industry, what individual. If I tell you to do something, it could be as simple as go get a drink of water. You're going to be like, who are you to tell me to do that? I'll get it if I feel like getting it.
Thirsty.
Right?
Yeah.
Right. That's my point, is that it doesn't matter the scale of it or the scope of it. You try it, you ask nicely, and if they produce, wonderful. Everybody's happy. Now, and we've seen so many industries step up. And so that leads into really what lessons are we learning from all of this that's going on right now? So let's you talk about how not to waste this, and you sent me something about like the 8 ways that we couldn't waste this or something that I want to get your feedback on. How do we take this terrible thing that's occurring and not, quote, waste it and learn from it?
There are several things that are really kind of, to me, fairly obvious. Number one, we need to play war games. What I mean by that, okay. I mean, you think about the military. Somebody somewhere in the Pentagon is sitting thinking about, well, what if a faction in China invades Taiwan or South Korea? What are we going to do, and what are our responses, and what are our resources to do that? And okay, well, what if a bomb goes off in Kashmir? The disputed territory between Pakistan and India. Okay, what would be the U.S. response? Now, God willing, we hope none of this stuff is going to happen.
Right.
But the military guys plan for it so they can, if the you-know-what hits the fan, they can pull out this thing and say, well, we've considered this, Mr. President, and these are our options. Fine. I turn around and say, look, we've had epidemics in 2002, 2007, 2009, 2012, 2016. now 2019, 2020, not to mention all the flu seasons in between. We need to sit down and have our planners in peace and quiet when it isn't epidemic time, play war games both for the medical response of what if a virus hits that hits pregnant women only, or a virus that causes blindness. I mean, I'm making this stuff up, but the point is they should consider these various scenarios. Now, they need to plan both medical responses and fiscal responses. I mean, we are suddenly playing catch-up ball with a $2 trillion quote, bailout, unquote, with all sorts of pork in it, which makes me really unhappy. We should have had a plan in place to say, well, what if another severe respiratory virus hits that's very contagious? Okay, well, what do we do medically? For example, we had a stockpile. I don't know if you know this. We had a stockpile of 100 million masks in 2008. In 2009, that stockpile was used in defense for the H1N1 epidemic at that time. A lot of those masks, of course, went to healthcare workers, but it went to other people. Okay. They didn't restore the stockpile.
Unbelievable. How could you not do that?
I'd rather not comment except to say that we need to learn from our own experience and everybody else's experience, which gets me to the next thing. We need to learn the lessons of, for example, what one state does in response to this to another state and look at it after the fact and say, oh, well, that worked better than that, whatever that is. Right. We can look at, for example, Italy versus South Korea. South Korea went ballistic with testing early on, testing everybody they could get their hands on. Italy said, no, just those people that we think might be infected. So South Korea knew where their hotspots were, knew where to put isolation and quarantine. And the last time I looked, they had something like 100 and some deaths, where Italy has something like almost 4,000 deaths. And the two countries have the exact same, almost the same population size. So it's reasonable to compare those two or contrast those two. My point is, we need to learn. You quoted me by saying we shouldn't waste this. We need war games that are both outbreak war games that are both medical and fiscal. We need to learn from other people, both our states themselves, our own countries. We need to learn something really interesting, I think, that ain't going away, which is that remote works.
Yes.
Yes. Okay, so I have two grandsons, and my daughter is telling me, they are getting at least as good an education right now at home with all the massive resources that are available online. They have these schedules by age. I bet you may not know this, in which case your teenage boys should. They have schedules for, well, if you're a 9-year-old in the third grade, here's a possible schedule for you to consider. Well, reading from 9:30 to 10, gym or playtime from 10 to whatever. And they're all out there. The people have already thought this stuff up. My point is that my son-in-law is working, and my daughter-in-law, both my children are married, are working from home 100%. And they're telling me they're just as efficient and effective sitting in front of, my son-in-law works for Cisco, and he's got video conferencing with India and with China, and he does that all the time. So What difference does it make where he does that?
And I think a lot of companies, I think fundamentally, our economy and the way that we do business is going to change as the result of this, because people are now seeing how this can work. Like, wait a minute, like colleges, for example. I think colleges are going to have a big problem trying to come back from this because, wait a minute, I can get the same education. I can take the same courses. I mean, okay, you can't do your hands-on labs, maybe, but everything else you can learn on the computer. My kids now have online curriculums. We're working from home. We're video conferencing with people like you and I are using. We're using Zoom. Zoom is exploded in their use because there's a huge demand now. People need to be able to do this. My wife's a teacher. She's a second grade teacher. It's funny you mentioned education. And so she's now having about every couple of days, all the teachers and the administrators, they're going onto a conference call. And they, using Zoom or Google Hangouts, I think, and they are, collaborating. They're hearing what's going on, how you doing with the students, or anything we can need. This is what's going on. We don't know how long it's going to last, blah, blah, blah. And they're talking about it, but they're able to discuss it and, ask questions. And you can have 50, 60, 70, 80 people all together, and it works. And you can
she can have
people.
Her second grade
and this
class.
is important, right? Just being able to see somebody. Phone is one thing. I can't see you. On the other end of the line, you could be going, yeah, whatever, right? But with a video, you can't, mimic that. People see the body language.
She can teach her students one-on-one, or we'll say 1-on-10 by video conferencing.
For those that have the technology, yes.
Seeing her. And, somebody raises his hand and say, Mrs. Smith, I've got this, or Mrs. Canavan, I have a question. Okay, ask your question. Yep. It really works. I bet you, here's something else you don't know that Stanford's been working on for a while that hasn't yet come out, but I really have great hope. Believe it or not, they're working on virtual reality teaching of surgery.
Wow.
Now, think about that for just a minute. In other words, I don't have to practice on a human being to learn to be good with what I do. I take care of babies with heart disease, okay?
Right.
If I could do that in virtual reality, I don't have to have anybody else except a pair of gloves and a mask and a computer, and that's all I need to learn and make mistakes in virtual reality. My point is, your statement that the whole structure of commerce and education, I think, is going to not go back to the way it was. I think it's going to have a big shot in the arm and go, whoa, I can get all this stuff online. And I can have a study group. I went to a business school, right? What's the key beyond the professors and the curriculum is your study group. Well, we had 5 people in my study group, and we can video conference.
As opposed to having it all meet in the library.
Yeah, instead of meeting in my dining room, which is what we did, I don't know how many times, with my wife serving food at 2 o'clock in the morning when we're writing papers.
Memories.
Yeah, I think this is another lesson a good lesson that we can learn from this experience. And I want people to take a positive view of this and say, okay, by the way, one other thing that isn't being pushed, if you look on the internet, you'll see it, but and the president did it with Mike Lindell, bringing him up to the podium. But there are thousands of Americans from some lady in the middle of nowhere. My daughter is sitting at home with her sewing machine just making masks. Right. Okay? There are probably millions, certainly hundreds of thousands of Americans who are saying, what can I do to help my community or my neighbor?
Sure, even if it's just to go shopping for somebody.
I was in a store, I don't know, about 4 or 5 days ago, and I saw this young lady, her mid-20s, with this huge basket of food. And I said something about, boy, you're really stocking up. She said, oh, no. I'm buying this for my 88-year-old grandmother, her next-door neighbor who's about 70, and the 2 people who live in the houses right next door. They all need food, and so that's
fantastic.
That's just the American people saying, I'll tell you something that sounds unrelated, and to me, I get a little emotional here. Did you see the movie Sully?
Oh, about the guy landing the plane.
Yes.
Yes.
Okay. The best part of that movie is the plane is sitting on the water. They have landed probably 3 or 4 minutes ago, and these boats, without asking or permission or anything like that, they were boats that were out on the river. There were a couple of ferries and a couple of pleasure boats. They just turned right around and said, okay, we need to help these people. I mean, the number of people that stepped up at 9/11 to help others.
Unselfishly. You know, we have the first responders that we talk about all the time, and the doctors and nurses that are on the front lines.
You betcha.
You know, you're a doctor. Two of my neighbors are nurses, and you know they're in the thick of things. You know, but everybody steps up. As Americans, we're resilient. We rise to the occasion. We've done it for our whole entire history, and it's just something else that now we've got to deal with. And we are going to deal with it. We are dealing with it, and we're going to get through it, and we're going to come out the other side stronger and smarter because we're going to hopefully learn from it. And it's going to make this country a much stronger place for a lot of the things that we've talked about, like bringing back a lot of the manufacturing, like bringing back medicine production, bringing back, other things that we realize are critical to our survival as a nation. We can't depend on some other country because what happens tomorrow if they decide, we're dependent on antibiotics from China and decide to stop shipping them? We're in a major problem if that occurs. And then, of course, the whole change to the economy and the system from this, like you said, you have this, the slogan, remote works. Remote does work, for, maybe not a one-on-one type of thing where you've got to be in charge in front of somebody, but for the vast majority of things, we're learning, wow, I can do this virtually. I can do this remotely, whether it's surgery or distance education. Like I have 2 online courses, one on self-defense and one on cybersecurity, how to develop a cybersecurity plan for businesses. It's a 7-week course, 7 modules long. Boom, you can do it online and learn it yourself. You don't got to go hire people to do it. You don't got to hire me to do it. I don't go fly to go there and help you do it. So yes. This is the way I think the world has been sort of transitioning to that, because the online education market has just been exploding in recent years. I mean, the last 5 years has just seen it go bonkers. And I can't remember what the numbers are, but I believe it's going to be in the tens, if not hundreds of billions of dollars in education transactions that are going to occur over the next few years, because things are just moving that directions. When you have individual businesses that are doing multiple millions of dollars a year, all you need is 100 people doing that, and you're talking hundreds of millions of dollars just from 100 people. So, and this is all happening, and we're seeing this transition occur, and it's exciting. And that's the positive, that we do have to focus on some positives here, because there's a lot of positives that I believe are going to come out of it once we get through some of the pain. And people are going to die, and people are going to be hurt, and it's going to be tough. Financially, people with paying bills and not having, income coming in for a lot of Americans and a lot of people throughout the world is going to hurt. And it's going to, we have to realize it's a short-term, what's the saying, right? Short-term pain for long-term gain. And I think that is exactly what we're going through. I'm glad, Dr. Deane, that you believe it's not going to be as serious as maybe some of the people that we're seeing on TV are saying it. Whether or not they're saying that because they are trying to err on the side of maybe a little bit of exaggeration to get the point across, I think is important, because I know myself. I mean, if I drove down to pick up my mail and a package the other day from a UPS store I get stuff shipped to, and there were a ton of cars out on the road. I mean, people in the lot at Lowe's, and it's like, people, you're not doing what you're being told, but they're out there. And so it's there's a lot going on. So let's talk about this combination of drugs that is seeing some really good results. We have the hydroxychloroquine, and then azithromycin, which is the Z-Pak, which some people have probably had if they've had bad infections. Do you think that is a short-term or even a long-term answer or solution to this problem right now?
I've looked at the data, the original data, the first 20 patients from Italy. Actually, it was a combination of an Italian Italian group and a South Korean physician, but they did it, the first 20 patients in Italy. But then subsequently, there are now, the last I saw, there were something like 30 patients, and like 28 of them cleared the virus. One patient actually died, but they were all seriously ill. Here's my point. Do I think that it could be a curative? The answer is I think there's a real possibility. Most important, I think this is something you have to consider when you have an 85-year-old who's having trouble breathing, who's maybe he's got heart disease and kidney disease and so forth, and coronavirus. You're going to have to give him these, or her, these drugs. Here's the problem. They have side effects. And hydroxychloroquine, I happen to be a cardiologist, it has an effect on the rhythm of your heart. And if you have a rhythm disturbance in the first place, you actually could make that disturbance worse with a drug. So
if you have an arrhythmia, that's bad.
Yeah, you have to be really careful. The doctor who prescribes this stuff has to know the entire medical history of that patient. And it leads me to one other thing that I'm seeing that I'm upset about to an extreme. At least 2 states I know of are talking about having what they call standards of care to decide who gets a ventilator and who doesn't get a ventilator. Right. And I feel not strongly, but vehemently, the only person who can make that decision is the doctor on the scene, and not a bureaucrat in some state capital or somebody in Washington. That person on the scene has to decide, is this person sick enough for me to, he's got heart disease, is he sick enough that I'm going to give him hydroxychloroquine and azithromycin? Well, that's my decision. I'll talk to the patient if the patient is not on a ventilator, in which case I can't talk to him. Is this patient a candidate for a ventilator? Well, I've only got 2 ventilators and I got 4 patients that might. I have to decide. I'm the patient, the doctor on the scene. I have to decide, and I don't want any rules or mandates telling me what to do. And that sounds frightening, but it is frightening. The last
reality.
Is a non-physician practicing medicine on a critically ill patient. And that's what these standards of care and mandated algorithms and all these other things, when you have a limited number of resources, the person on the scene with an MD after his name or her name has to decide.
Yeah, because you're the only one at that point in time that can make the call. If I provide this care to this person, what's the chances that they're going to survive? If those chances are next to nothing, do you really want to devote those resources to that person? And as opposed to somebody else who's next to them that has a very good possibility of survival. You're the only one that could possibly make that call, even if the, quote, standard of care that's been mandated says the opposite, right? I mean, it makes no sense.
That is exactly my point. And the reason I make this as strongly as I do is, you probably don't know this, but the British health system, the National Health Service in Great Britain, which is a single payer, has age thresholds over which you cannot do dialysis for kidney failure or open heart surgery over the age of 65 or whatever. That's the single payer, government controlled approach to medical rationing. And my very strong position is medical rationing is done between a doctor and a patient, and the government's got no business being in there. And I say that as loudly as I can say it, because the people who want a single payer don't understand that that means the government will be practicing medicine on them rather than their doctor practicing medicine on them.
So that's a perfect segue into talking about your book. One other thing I wanted to ask you, but I want to share my screen here for our listeners and viewers so that they can see your book, which it talks just about this exact topic, I'm sure, which is curing the cancer in U.S. healthcare, states care and market-based medicine, right? So tell us a little bit about the book, why you wrote it, and what it's about.
The reason is actually very simple. I had this sort of epiphany when I was in business school, and I started studying systems theory, and I realized that systems theory is a way to fix a broken system, and medicine, practice of medicine, is a way to fix a broken, forgive the phrase, patient, a sick patient. And I realized that I could use the tools of business to study why the patient named US Healthcare is actually sick. And if you know the reason, the root cause, what we call the etiology of a patient's sickness, then you can actually cure that patient rather than simply treat his symptoms. So I spent several years taking all those tools and, strategic analysis and queuing theory and learning curves and all this, and I applied them to this patient called healthcare, and I came out with a diagnosis, and the diagnosis is actually that the U.S. Healthcare system, as a patient, has cancer, and the cancer is Washington, and to remove the cancer, and that means removing Washington and letting the people in their states decide what kind of a system they should have. Secondly, and possibly more important, that the second half of the subtitle is market-based medicine, and all that really means is that the patient gets back control of his health care and his money, so that the patient actually pays the doctor or the hospital or the pharmacy, not some third-party payer. And when that happens, you're going to watch prices plummet. You're going to see people in control of their own lives. And that's what we really want in healthcare, which is people making their own decisions, recognizing they are personally responsible for their health. I'm not, the government is not. And that's what this book says. It says, you should be in charge of your money and your health care. You should get the advice of a physician of your choice, not chosen by a health panel or by the government. And that's the book.
That's awesome, because free market-based medicine, basically, right? A free market. You want it to be competitive because it drives prices down. If you have a single-payer system, you have socialized medicine. They're dictating the rules to you. They're telling you when you can live, when you can die, when you can have a procedure, when you can't have a procedure, how much to pay, when to pay, where to go. All of those choices are taken away from you, and so that's fascinating. I love the cover too. You got the stethoscope right on the sort of the taking the heartbeat of the United States there. That's a great cover. So I urge people, if they're interested in learning more about how we can correct the problems that are inherent and that exist inside of our healthcare system, to get a copy of Dr. Deane Waldman's book, Curing the Cancer in U.S. Healthcare, because it's fantastic.
I have to say, you mentioned free market, and in there, because the most common complaint I have is, oh, well, yeah, your plan sounds right, but I can't possibly afford it. Well, there's a table in there that shows what the difference in prices are between a third-party payer insurance system and a free market system. And what you quickly see when you look at this table is that patients pay something like 10 to 20% of what the charge is now. Meanwhile, the doctors get paid more, and the patients can decide when they get their knee replacement or their cholecystectomy or their gallbladder taken out. My point is that once you get beyond the idea of, well, of course the government should take care of me, and you realize, no, I should take care of me, and I want to be in charge of my money and my life, and I can afford all this stuff in a free market. I just can't afford it in the current market.
It's crazy how you get a bill for something and then it's like, this is the billing amount, but this is what you can pay us. Like, well, then why even have that number on there? it's definitely a broken system. So I'm looking forward to reading your book. I'm definitely going to get that. And so just a couple quick things I want before we wrap up here. I knew we were going to crank through our hour together, so I appreciate your time. One of the things that I think people are interested in knowing, and you being a pediatric doctor would probably be one of the best people that could answer this. Why do you believe, or do you know, that the young are not being affected by the COVID-19 virus?
I do not know the answer to that, but I can speculate, and that is pretty much all viruses that hurt us, that cause sickness in one of two ways. Either our bodies have an immune system that cannot fight off the virus, or that's the elderly, the patients on chemotherapy and so forth, or the virus can actually create an overreaction, an immune overreaction. And I have to wonder whether, for example, H1N1, which did attack children more than young people, more than old people, whether that was because their immune systems were so good that they overreacted. And that's also why I am not worried terribly about children with COVID, because COVID doesn't look like it causes an overreaction. It attacks those who have weakened immune systems, not the really powerful immune system that a 5-year-old has who's been playing in the dirt for 4.5 years.
And that's kind of what I was thinking too, because not only that, but they've been getting vaccinations for years. So their bodies are used to producing the antibodies. So to their bodies, it's like, it's just another virus, boom, produce some antibodies, I'm good to go. That's kind of what I'm thinking, because they're used to it. And like you said, they're playing in the dirt, they're around tons of germs, putting their fingers in their mouth, everything goes in their mouth up to a certain age, right? But that's kind of what I was thinking. So that's interesting that you pretty much, that's the same track there. Last question, then we'll have to wrap up here, because this is something I wanted to get to. And you talk about, what do you mean by, in the looking at everything that's happening here, what do you mean by using nations as laboratories of viral research?
That was, I was really thinking specifically of comparing, I've read a couple of articles comparing Italy's response to COVID virus to South Korea's response to COVID virus. And what we need to do is Justice Brandeis, back in, I think, 34, 35, on a totally unrelated case, said the states have to be laboratories of democracy. Well, I see the nations as being laboratories of viral response. And so that's my point, was that we should look at our states and see the differences there, but we should also look at China's response. Now, the trouble is, we're not going to probably have reliable data, right? But okay, to the best we can, let's see what we can get. Italy, South Korea, France, Germany, Great Britain, let's see what they did. I'm talking about next summer, right. Next August, September, October. The CDC analysts should sit down and say, okay, let's look at all of this experience and what can we learn so that we can prepare for the next outbreak, because the only thing I can guarantee is that it will happen.
Yes, it definitely will happen again. And we unfortunately, I think a lot of people now that maybe didn't really understand what some of these other respiratory illnesses were like SARS and MERS, now realize, wow, so this is what an acute respiratory disease could possibly do. And, if we're not prepared, as we've seen what's happening, we can't afford to shut down our economy for a month every time we've got a new outbreak. And, comparing the numbers like we did at the top of the show, compared to the seasonal flu, the numbers we're seeing are nowhere near that. And we don't shut down the economy and the world and, everything for a month because the flu hits every year. So it'll be interesting to see going forward.
There's another little lesson, which I don't think is so little. SARS, the R is respiratory. MERS, the R's is respiratory, just as you said. And COVID, although it doesn't have an R in there, is a respiratory virus. It attacks people who have weakened lungs. And one other thing we ought to learn, of my fellow Americans, is stop smoking.
Great advice, because that damages the lungs.
Let's face it. If you want to be healthy and be protective against this virus, you should have healthy lungs, which means you shouldn't have been smoking for the last 5, 10, 30 years.
I just had a bit of an epiphany. I wonder if, and obviously there's no scientific research for this, but I think it should be researched. I wonder if some of the younger people that are succumbing to this vape.
Very interesting thought. I would love to have somebody, and I don't know if anybody's collecting this, specific medical demographic data on all of the patients who have died. I would like to know, do they do autopsies? I mean, I'm a pathologist. I know how hard it is to determine the cause of death, even with an autopsy. So how do you know that person who is in the first 19 patients who died in this country all died in a nursing home, average age something like 86 or something, okay? Right. And they tested positive for COVID. My question is, how do we know that they died because of the COVID virus? Maybe they died because of the kidney failure or their chronic lung disease. So right. My point is, we need to learn everything we can, and that includes finding out your question, which I hadn't thought of, but it's a very interesting thought. For all I know, those children, the few that have died, or the man who died, the 40-year-old who died in first death in our state here in New Mexico was a 46-year-old. Maybe he's been smoking for 20 years.
Right. It's going to be interesting to see what sort of research and data is culled from this.
It's important to see, not just interesting, because we can learn. And so, a year from now, we can say, okay, this is what we know you shouldn't do for your own safety.
And some people will listen and some people won't, as they always do. So if our listeners are interested in learning more about you, Dr. Waldman, or if they're interested in getting a copy of your book, Curing the Cancer in U.S. Healthcare, where can our listeners go to learn more? I know you have a personal website, which is your name, right? Deane Waldman, and that's Deane, D-E-A-N-E, Waldman, W-A-L.
My mother put an E on the end of Deane 76 years ago, and I've had to qualify for basically all of that time. So it's www.deane with an E Waldman. I encourage people to go to the website partly because of its title, which is We Can Fix Healthcare. But there's also a lot of free information. There's free videos. You just need to sign up. There's no charge, including the one that just came out, which is Injecting Reality in COVID Mass Hysteria. And
I like it.
And a lot of people have seen that and have gone, oh, wow, yeah, really. So I encourage people to go to the website. You can get the book on Amazon. That's, no problem, and it's not expensive. So, it was intended for the general public, not for other policy people or for politicians. Lord knows the politicians are not going to like my book, because what I'm trying to do is return power to the people, the patients, who I call we the patients instead of we the people, right. Instead of keeping it in Washington.
So you're on social media, I know, so our listeners can search for you on Facebook and LinkedIn and Pinterest. You can find you all over the place, and YouTube. So that's fantastic. When we post this, we'll have the links out there. You have any last thoughts for our audience before I let you go, sir?
No, yes. My last thought is we will get through this. We will get through this together. And hopefully, I don't know for sure, but hopefully we will learn from this so that we will be better protected when the next one hits.
Excellent. Thank you so much for your insights and great information for our listeners. Thank you so much for being on Safety Talk, Dr. Waldman. Thanks, of course, to our listeners for tuning in to Safety Talk. And you can always get more information as well as past episodes and additional safety information at safetytalkpodcast.com, and direct link right to our YouTube channel at safetytalkvideos.com. So until next time, everybody, please, more than ever, stay safe.